State Minister of Health, Your Excellency Ilyas M. Magosi, Secretary Executive Director for COMESA, and those of you who have joined, high-level leaders, Dr. Hamed Noor, United Nations Representative to AU and EEC, and Excellency Ms. Afshan Khan, UN Secretary General for Scaling Up Nutrition Movement. Ladies and gentlemen, all protocols are observed. Today, we'll be having the Africa Union Summit high-level nutrition side event with the theme of Achieving Nutrition Goals in Africa Post-Malabo, Public and Private Sector Sustainable Nutrition Financing. This event will be moderated by Madam Esterina Lisinge Fotabong, sorry for saying the names like this, Director for Agriculture, Food Security and Environmental Sustainability at the AUD-NEPAD, and she will be moderating the official session. Madam Esterine, you are most welcome. Let's give her a round of applause to the podium.
Good morning and welcome to everyone. As my brother Dr. Sese introduced me, I'm Esterine Lisinge Fotabong, the Director of Agriculture, Food System and Environmental Sustainability at the African Union Development Agency-NEPAD. We want to welcome everyone who is here and those who are online, and really to apologize for the slight delay in the start of our important high-level event on nutrition. I think those who follow the AU process will understand that some of the high-level delegates and participants who are here probably got back to the hotel a little bit late, because the Executive Council actually went on till about 2 a.m. this morning. So actually, as I'm speaking, I'm slightly sleeping as well, because I got to my hotel quite late. So I just thought I should mention that, and that might be why some of our senior participants are not yet here. But that said, let me officially start by actually welcoming and recognizing the presence of the Minister of Health of Ethiopia, His Excellency Dr. Dereje Deguma. We appreciate you being here with us. I know that Her Excellency Madam Nandos Bikele, the CEO of AUD-NEPAD, is on her way, and she should be here in any minute. Let me also recognize the presence of Dr. Mobita Luwambarwa of SADC, representing the Executive Director of the SADC Secretariat. And I think online we have the UN Assistant Secretary General for Scaling Up Nutrition, SON movement, Mrs. Ashwin Khan, and Dr. Hamid Naru of WFP. I think he's also online. We have apologies from the Commissioner of Agriculture and Rural Development of the the African Union Commission. As I said, I think she's one of those who got to the hotel at 2 a.m. this morning, so perhaps she will be joining us later in the day. Let me recognize all the representatives of the REX, the representative of international organizations, private sector, civil society, and non-state actors, media, journalists, and of course, so I was perfect in my timing. My boss, Her Excellency Mrs. Nandos Bikele Thomas, just walked into the room, and as I said, she will be two minutes away, and she's exactly 2 minutes, and here she's with us. Thank you all so much for being here. We really want to appreciate all the friends of Africa who are gathered with us here today. Not just the member states, we know you'll be here, but all the friends, the partners across the globe who are here with us to discuss such an important issue relating to the development of this continent. I was hesitating when I was going to, in my moderation, whether I should give the statistics. But I think they are important because it just situates us and puts into context why this event is so important. The last I checked, we have about 20% of the population, African population, that's undernourished. That's a significant number. And about 30% of our children are stunted. That really is something that should keep us all thinking hard. And about 7% of our member states have their stunting rate below 19%. This is concerning. I mean, especially for a continent that, as is often repeated, and I will just repeat it for emphasis, a continent that is immersed in its diversity. It has immense potential and innovation. And that diversity includes the range of crops that we have in this continent. Yeah, so it is it's puzzling why we still have the situation of undernourishment, of malnutrition in our continent. And as we know, our children are our future. So if we have 30% of stunting, that really tells and will have an impact in the economic development of this continent. So we need to do everything that we have to do to change this picture. And of course, that brings us to the subject of today's high-level event. There are other issues of policies and so on, but the importance of financing nutrition is critical, and the importance of looking at a full range of possibilities in terms of financing is critical. So the conversation that we're going to have with regard to public-private sector investing in interventions, nutrition-based intervention, it is of paramount importance. So because we are starting a little bit late, I will not take us delay too much of our time, but to really emphasize the critical importance of this conversation, particularly at a time when we are looking at a post-Malabo framework for the continent. The Maputo decision on CADAP was important, but perhaps did not give sufficient attention to the issue of nutrition. We tried to correct that with the Malabo declaration on food security in the continent. But I think now we have learned in the 20 years of implementing CADAP on the things that we can do and that we should do better in terms of making nutrition a centerpiece in our food systems and agricultural transformation in the continent. So this conversation today is very timely. It is one of the first in a series of consultations that we are going to be having for the Post-Malabo process. And so we are really, really, really honored to have all of you here. And we are very honored to have these partnerships with Results for Development, with the Sun Movement. This partnership, we believe, will play a very critical role as we look into the post-Malabo process. That said, please allow me, therefore, to go and just introduce the dignitaries that we have for our high-level opening session. I think I already recognize His Excellency Dr. Dereje Doguma, the Minister of State for Health in Ethiopia. Her Excellency Madam Nandos Bikile Thomas, the CEO AUDA-NEPAD, and the SADA Secretariat that will be represented by Mr. Lobita. And of course, we will have Dr. Haminaru and Mrs. Ashwa Khan, who are not here present, but they will deliver their statements online. So let me welcome Her Excellency Madam Nandos Bikile Thomas to give us her opening remarks. Please give her a hand.
Here. So, does it work? Yeah, so if I'm a little bit late, apologies. First of all, I would like to thank the Minister for being here, Dr. Dereje. I know that, I had my contacts with the mayor, but she seems to be busy. It's a busy time, so we have accepted the apologies, but we have had very insightful discussion with her, and we're very pleased of the work that she's doing in terms of school feeding program. I would also like to recognize Dr. Khan. He's here, right, Dr. Khan? Yeah, if not, anyway, his representative. I know this is a very, very, packed time, but, for those that have made it, you're welcome and thank you very much. And all representatives, my colleagues, the regional economic communities that are here, all the international organizations, the media, that is very critical and very important, and our partners. Excellencies, distinguished ladies and gentlemen, it's with great pleasure that I address you today on a topic that is very close to my heart, harnessing the power of the public and private sectors to address one of the most pressing challenges of our future and our time today, hunger and malnutrition in all its gloom. I said in the future because if we do not correct it, and even if we correct today, those that have suffered will still be lingering around us, and that's going to be really a problem. It's a challenge if not resolved today. The question now is, how do we tackle this? How do we realize Agenda 2063? How do we build a prosperous and well-developed Africa that is free from hunger and malnutrition? As we convene under the theme, Achieving Nutrition Goals in Africa, Post-Malabo, Public and Private Sector Sustainable Nutrition Financing, we stand at a pivotal juncture, approaching the conclusion of the Malabo Declaration in 2025. This event is coming at a time when political will and commitment to nutrition are at their highest, and when there is increased awareness that malnutrition is not only an African problem, but a global challenge. Despite being endowed, like my sister just said, with vast agricultural potential, Africa remains beset by formidable obstacles in ensuring food security and adequate nutrition for its population. In 2022, it was reported that 2.4 billion people, comprising mainly women and youth, living in rural areas, did not have access to nutritious, safe, and sufficient food all year round. Climate change, the rising cost of a healthy diet, and the overall rise in inflation have also continued to leave billions without access to an affordable, healthy diet. In addition, hundreds of millions of children under the age of 5 continue to suffer from nutrition-related disorders such as malnutrition, stunning, and wasting. To meet the nutrition targets stipulated in the Post-Malabo framework, such as reducing stunting by 10% by 2025, Goal 3 of Agenda 2063, and SDG 2 on zero hunger, we need sustainable resource mobilization strategies focusing on nutrition and locally produced nutritious foods, such as through NEPAD's Homegrown Solutions Program, which promotes agro-industries and smallholder farmers. This approach is essential to address the continent's nutrition needs effectively and ensure the health and well-being of its population. Ladies and gentlemen, addressing malnutrition in Africa requires a comprehensive approach encompassing nutrition-specific and nutrition-sensitive interventions. Relative to this, our NEPAD is working with member states to mainstream food systems and nutrition in the CAADP process and accelerate public-private sector investments in Africa. These interventions, ladies and gentlemen, are crucial for immediate nutritional needs and long-term health outcomes, especially for vulnerable groups such as children and pregnant women. Nutrition costing is vital in informing policy decisions and resource allocation for nutrition interventions. This approach guides governments and stakeholders to understand the financial implications of scaling up nutrition programs and ensures that limited resources are allocated efficiently to address the most pressing nutrition challenges. Throughout NEPA's Comprehensive Africa Agriculture Development Program, the CAADP, African governments agreed to allocate at least 10% of national budgets to agriculture and rural development, and to achieve agricultural growth of at least 6% per annum. These investment commitments have resulted in reduced poverty and malnutrition, increased productivity and farm incomes, and improved sustainability of agricultural production and use of natural resources. The lessons learned from Malabo should serve as a blueprint for galvanizing African governments to prioritize nutrition and allocate an appropriate percentage of their national budgets toward addressing this critical issue. Indeed, ladies and gentlemen, CAADP serves as a prime example of how targeted nutrition costing can serve as a powerful tool for driving sustainable development outcomes. By integrating nutrition considerations into broader agricultural planning processes, policymakers can foster holistic approaches to food insecurity. Through strategic investments in nutrition-sensitive agriculture and the promotion of locally produced nutritious food, governments can not only enhance the well-being of their populations, but also lay the foundation for long-term economic prosperity and resilience. Excellencies, distinguished guests, our collective journey toward eradicating malnutrition is guided by the Global Nutrition Goals, the African Union's Agenda 2063, and the Sustainable Development Goals. Our NEPAD has been at the forefront of this, leading initiatives such as the African Nutrition Scorecard and developing win-win guidelines for private sector engagement in nutrition in partnership with the FAO and within the CADEP framework. We are also in the process of establishing Africa Nutrition Financing Hubs, which represent a significant step toward a significant step forward in accelerating the implementation of Agenda 2063 and providing vital support to member states. These hubs have the potential to serve as central platforms for coordinating efforts, sharing best practices, and mobilizing resources to advance nutrition initiatives at both regional and national levels. Furthermore, recognizing the power of youth, we have established the Youth for Nutrition Initiative, which advocates for the effective role of young people in food systems through deepening youth engagement across the African continent to act as promoters of nutrition in their communities, raising awareness and advocacy on the importance of good nutrition and forging partnerships and collaboration among governments, civil society, youth, women, and the public and the private sector. And that in creating sustainable solutions to address hunger and malnutrition. Excellencies, as I conclude, I wish to extend my deepest gratitude to our esteemed partners, the Government of Ethiopia, the Mayor of Addis Ababa, Results for Development, and the Scaling Up Nutrition Sun Movement, who have played a pivotal role in organizing this significant event. Your tireless efforts and dedication have been instrumental in ensuring the success of our partnerships, and we are immensely grateful for your unwavering commitment to a prosperous, well-nourished, and thriving Africa for all. I thank you.
It's laudable, and we really appreciate that she's here with us. At this point, I think some key messages that she raised and that we'll run through. Importance of a multi-sectoral approach that combines nutrition-specific and nutrition-sensitive approaches, nutrition costing, the importance of having firm commitments, investment and financial commitments for nutrition, and of course partnerships across board are critical as we move forward. Let me invite Dr. Mobita, the Director of Policy Planning and Resource Mobilization of the SADC Secretariat. I've given him a big hand.
Director of Program, apologies. Director of Program, thank you very much for the invitation, and I wish to extend from the outset apologies from the Executive Secretary, His Excellency Las Mahosi, who has an ailment this morning and had to go to the clinic. Program Director, Honorable Minister, Senior Government Officials present, Chief Executive Officer, AUDA NEPAD, Chief Executives and Heads of Regional Economic Communities. Let me recognize also the UN family and also distinguished representatives of international cooperating partners present. Let me just say, distinguished delegates, ladies and gentlemen. It gives me great pleasure to be part of this important gathering to the African continent on this important subject. From the outset, allow me to thank the organizers and to also recognize the very important theme and meeting at this important event. The CADIP, which I will not endeavor or attempt to go into because there'll be a session for that, let me just say that it's a key instrument in promoting food security, nutrition, and increasing agriculture productivity and public investment in agriculture in our member states and the continent at large. It would be amiss for me if I did not applaud the organizers for their strategic focus and also for the theme, Achieving Nutrition Goals in Africa, Post-Malabo, Public and Private Sector Sustainable Financing. This theme is not only relevant, it is timely. The theme demands the full engagement of stakeholders, as was rightly pointed out just a moment ago, including governments, the private sector, the civil society, and at all levels. Honorable Minister, Excellencies, distinguished delegates, I must say this event resonates very well with SADC priorities. The region, SADC in this case, has developed regional agriculture policies under the guidance of our member states, and this is to cascade the CADIP to the region. Importantly too, individual SADC member states have developed national agriculture investment plans to domesticate CADIP and the regional agricultural policies. While the region continues to make important progress towards nutrition goals in Africa post-Malabo, we will see, and admittedly so, that a lot still needs to be done for us to meet the set targets. As indicated in the fourth CADIP biannual review report, we recognize that the SADC region, as well as the entire continent, as shall be discussed by our experts later on, has done well in a number of commitments, but much remains to be done. Honorable Minister, distinguished delegates, Excellencies, ladies and gentlemen, I will not attempt to go into the numbers, into the analysis, because there will be time for that, and we have them before us, and we look forward to that time. Let me just underscore the important fact that child malnutrition remains a concern in SADC, with stunting rates in the region surpassing 25% in most member states. The region's 19 million stunted children represent a third of all cases in Africa. Additionally, 4 SADC member states have child wasting rates exceeding 5%. These are facts which we need to face squarely. Honorable Minister, distinguished delegates, malnutrition, including stunting and wasting, are closely linked to compromised brain development and result in negative macroeconomic complications and implications. Evidence shows that across 95 low and middle income countries, stunting's long-lasting effects result in reduced income potential for individuals and costs to the private sector of up to very astronomical figures and as a percentage of the GDP. Honorable Minister, distinguished delegates, given the significant impact of malnutrition on child development and its macroeconomic implications, mobilizing adequate resources should be a policy priority. We need the money, we need the funds, we need the resources, and the resources are there. They just need to be harnessed. It is therefore critical to routinely track nutrition expenditure to inform policy. Honorable Minister, Excellencies, distinguished delegates, to address the current reality in the region, SADC has developed the Regional Food and Nutrition Security Strategy, spearheading the 3 programs and aimed at achieving nutrition goals post-Malabo. Firstly, in 2023, a tracking tool for public financing for nutrition was developed and approved. Plans are underway to roll out this tool to all member states to domesticate it so that it becomes the main reporting method for nutrition financing. As I indicated earlier, Excellencies, financing is there. We just need to harness it. Secondly, Honorable Minister, distinguished guests, an obesity prevention strategy is currently being developed to reduce obesity and is expected to be finalized during the year. The third area in scaling up industrial food is industrial food fortification in the region, where landscape analysis has been conducted in our member states to identify fortification bottlenecks, policy and capacity gaps, including assessing industry readiness to implement mandatory food fortification where vitamins and minerals are added to commonly consumed foods during processing to increase their nutritional value. Some member states, I must state, have completed their landscape analysis and they are to be applauded. And at different stages of implementing and recommending and making recommendations from the findings and adopting the SADC minimum standards on food fortification as approved in 2022. So as you can see, despite the challenges, there is effort and there is some progress, but more needs to be done. Large-scale food fortification presents a unique opportunity for private sector engagement and harnessing the food industry for positive nutrition impact post-Malabo. Honorable Minister, distinguished delegates, SADC obviously will benefit greatly from the current and ongoing work by our NEPAD and our Food and Agriculture Organization on engagement with the private sector, because the private sector is key. It is our hope that in post-Malabo, a private sector engagement in nutrition financing is highly prioritized by all players to unlock the value in this key sector, which is already playing an important role in large-scale food fortification through the milling industry in maize and wheat, edible oil fortification, as well as salt nutrition. Honorable Minister, distinguished guests, ladies and gentlemen, we can go on, but just to underscore that financing is a requirement. Financing is there is commitment, but there's much more work to be done. Allow me to end here. End of quote.
Thank you. Thank you, Director, for that message. I think you also emphasizing the importance of partnership, the importance of tracking and monitoring the financial commitments, the importance and the role of private sector in the food fortification. These are just some of the messages that are coming through from your delivery. Let's now invite Dr. Hamid Noru to make his intervention, the WFP representative to the AU and ECA. My brother, Hamid, are you online? Please go ahead.
Your Excellencies, honorable guests, ladies and gentlemen, I'm truly grateful for the opportunity to address this esteemed gathering today on behalf of the World Food Programme. We find that this particular topic, which is achieving nutritional goals in Africa post-Malabo, public and private sector sustainable nutrition financing, is really very well timed. Today, we confront a stark reality. After decades of progress made in the fight against hunger, the COVID-19 pandemic and many other global and African trends has exacerbated an already precarious situation, pushing nearly 282 million people in Africa into undernourishment, which equates to approximately 20% of the population, and a staggering increase of 57 million people since the outbreak began. The ambitious Malabo Declaration aimed to end hunger by 2025 through increased agricultural productivity, reduced post-harvest losses, improved food safety, reduced food and nutrition insecurity, and improved social protection has only been achieved in a handful of countries in Africa. Food systems and nutrition interventions are very powerful tools for governments to harness and use in order to drive capital investments. Reducing stunting, for instance, is not just life-saving, but it also boosts GDP by up to 11%. There are many examples that I can give to make this case. However, the path to achieving zero hunger by 2030 comes with a very heavy price tag. An estimated $56 to $163 billion increase in additional funding is required between 2021 and 2030. This is a huge gap, and we need all our efforts and effective partnerships and collaboration and innovative financing in order to address this big gap. The World Food Programme works both with the public and private sectors to secure sustainable nutrition financing, to support nutrition programs and interventions, not just in Africa, but globally. WFP engages in advocacy efforts to encourage governments to prioritize nutrition investments and develop policies that support sustainable food systems and improve nutritional outcomes. This may include advocating for increased budget allocations for nutrition-sensitive programs and policies in various member states. For example, tremendous progress has been made on the homegrown school feeding coverage in Africa, with about 66 million children receiving school meals in 2022. What is more important to note is that domestic budgets, domestic financing, now represent the primary source of funding for school meals programs in Africa, with the share of domestic funding hovering at about 85% as of the close of 2023. This is very significant. 85% funding is coming locally from member states, and this has to be tremendously encouraged. WFP also supports member states to leverage deployment of financing from international financial institutions, including the Africa Development Bank and others, for increased investments in food security and nutrition. A recent illustration is the Africa Development Bank's transition state facilities, financing Mozambique and the Democratic Republic of Congo on WFP-supported proposals. These projects will address the intersecting challenges of climate change, conflict, food insecurity, and aims to enhance the adaptive capacities of communities and strengthen their ability to withstand shocks and crises. Ladies and gentlemen, our private sector partners have a vision for a world without hunger, and they trust that WFP and its partners can deliver on this. WFP works with private partners across the sectors and areas of expertise to deliver to those most in need every single day. Allow me to cite just a few examples. WFP and MasterCard Foundation raised funds to provide more than 100 million school meals to children in need. MasterCard's impactful campaigns are helping WFP provide vulnerable children with a healthy meal that they need to grow every day and also to thrive in the school environment. while with the help and expertise of DSM, another private sector global partner, we are co-creating standard settings, innovative specialized nutritious foods, and helping improve the diets of more than 30 million people worldwide. Overall, public and private sector sustainable nutrition financing is essential, it is imperative, it is important for addressing the root causes of malnutrition, promoting healthy diets, and building food secure resilience. The World Food Programme stands ready to support the African Union, its specialized technical agencies such as USAID, and other partners, including its member states, to accelerate practical solutions to move the needle significantly on nutrition across the continent of Africa, focusing on the needs of the most vulnerable. And we invite the international community to join us in this effort. Ladies and gentlemen, let us be the generation that ends hunger in Africa. It starts with you. It starts with us. Thank you very much.
Thank you, Dr. Hamid Nehru, for those remarks. Indeed, let us be the generation to end hunger in Africa. And I think we should actually applaud our governments, our member states, for the statistics that he just mentioned. 85% for school feeding programs is covered by our member states. I think that's something to be recognizant of, to be proud of, but also he mentioned the gaps that are still there. And that's why we need these partnerships to have the private sector, other actors, philanthropic organizations, and so on, partnering with African member states to do what he just said. Let us end hunger in the continent. Thank you so much for that. It is my pleasure now to invite the Assistant Secretary General for the SUN program, or the SUN movement, coordinator, Mrs. Ashfan Khan. I think she is online. Hi, you have the floor.
Good morning.
Good morning.
Good morning. Distinguished Excellencies and esteemed colleagues, on behalf of the SUN movement, I thank you for this opportunity to join you in highlighting the critical role of increased financing to eliminate malnutrition. Not only does investment in prevention, care, and treatment of malnutrition offer high returns, with data showing that every dollar spent yields an additional $16 to the local economy. But in addition, we know that the costs of inaction are far too expensive to ignore, with studies estimating that malnutrition is costing African countries between 2 to 16% of their GDP in lost productivity, educational impairment, and excess health expenses. To respond to this crisis, we know that scaling up proven nutrition interventions is the key, and that political will is the driver. We also know that there are opportunities across multiple sectors, ministries, departments, and agencies to prioritize nutrition outcomes and make sure that we're using every resource available for nutrition through agriculture, health, education, energy, industry, environment, social protection, and water and sanitation, among others. In the Post-Malabo Declaration timeframe, we particularly recognize the need to accelerate agricultural growth as part of a broader transformation of national food systems. This transformation requires that growth in the sector nourishes our people, our local environments, and indeed our planet as a whole. We must also ensure that our actions specifically support smallholder farmers, especially women and other vulnerable populations, that fiscal and trade policies promote nutritious and sustainable food for all, that we build resilience to shocks, and that we prioritize the agency and nutritional needs of women, adolescent girls, and children. The Sun Movement exists to support all country stakeholders across sectors, to develop clear, costed national nutrition plans and link them to food system pathways to support countries' ability to track nutrition expenditures across sectoral budgets and from the national to the local level to leverage the power of civil society and identify gaps in the national response and rally communities in support, and to incentivize private sector investment in healthy, sustainable, climate-resilient food systems. In a few weeks, we will celebrate International Women's Day. And this year, we focus on accelerating progress by investing in women. Our finance objectives and nutrition goals have to consider the disproportionate effects of both climate change and malnutrition on women and girls, not merely as beneficiaries, but as agents of change, as healthcare workers, farmers, vendors, consumers, mothers, and caregivers. As we look to the future, beyond the expiration of the current Malabo Declaration targets, it's important that we not only recommit ourselves to investment in agriculture and nutrition, but in a transformative agenda that maximizes domestic spending as well as outlines clear investment cases for donors and the private sector to build a stronger, healthier African continent together. We stand ready to support you in your work and look forward to sharing successes and learning from one another at the Sun Global Gathering in Kigali in November. I hope to see you all there and wish you a productive and successful meetings today and in the days ahead. Thank you for the opportunity to partner with you and to address you.
Thank you so much, Ashwan, for that message. I think, again, some common themes have been coming through, the tracking of nutrition expenditure across sector, but I think she so much demonstrated the cross-sectoral approach that is needed and the interministerial approach as well for nutrition sensitive purposes. I really like the spotlight she gave on women, not just as beneficiaries, but as change agents across the food system. So thank you really for those words. Now, I think I would like, before I invite the minister, I would like to also recognize the presence of Dr. Laye Tandise, the former Minister of Health for the Federal Democratic Republic of Ethiopia. Minister, you're welcome. Thank you for being here with us. Now it is my immense honor and pleasure to invite His Excellency Dr. Derije Dokuma to give us the keynote address. Minister, please welcome him as he comes to the stage. Thank you.
Thank you so much, Estherine, the program director. Good morning, everyone. Good morning, እንዴት አደራችሁ? Her Excellency Dr. Laye Tandise, former Minister of Health, Excellency Mrs. Nardos Bekkele, CEO of NEPAD, Excellency Mrs. Afshan Khan, UN Assistant Secretary General and the coordinator of the Sun Movements, who joined us virtually. Dr. Hamid Nuru, UN representative to AU and ECA. Ambassador Dr. Mohammed Kadash, Assistant Secretary General to COMESA. Dr. Mubita, Director of Policy Planning and Resource Mobilization of SADC. our sister Fralem Shbabau, former State Minister for Ministry of Peace, representing the CSOs, heads of development partners, heads of agencies, excellencies, ladies and gentlemen, a very good morning to all of you, and those of you who have traveled long way to Addis. Welcome to your city, Addis Ababa. Welcome to Ethiopia, your home country. And thank you very much for having all of us together here on this very important meeting on Sekota Declaration and nutrition-related matters. Excellencies, ladies and gentlemen, nutrition is a critical issue for human well-being and economic development of nations. This is achieved through improving child and maternal health, reducing disease burden through stronger immune systems, enabling healthy and safer pregnancy and childbirth, and a lower risk of non-communicable diseases. As most of previous speakers rightly mentioned, good nutrition is also an important issue to improve educational performance, to improve productivity, and to enhance life opportunities in the long term. This is why nutrition is considered foundational to achieve most of the sustainable development goals. Though we all understand the importance of a good nutrition, a large number of our population in our continent and globally are still affected by acute and chronic malnutrition. Reports showed that Africa shows rising number of stunted children due to population increase and an almost stagnant prevalence of stunting over the past 2 decades. Of the 34 countries that account for 90% of the global burden of malnutrition, 22 of them are found in Africa. Excellencies, ladies and gentlemen, as we recognize that malnutrition has a large social and economic costs. According to the Food and Agriculture Organization estimates, malnutrition costs the global economy approximately $3.5 trillion per year, or 5% of the global GDP. The cost of hunger study in Africa showed our continent loses significant amount of the GDP due to malnutrition as a result of illness, deaths, loss of education and innovation potential, and productivity losses. In the case of Ethiopia, the same study has showed that we lose about 16.5% of our GDP, which is equivalent to 55.5 billion Ethiopian birr, approximately 1 billion USD every year, because of the consequence of stunting, mainly on 3 areas: illness and death, loss of educational performance, and inadequate workforce productivity. Due to these high social and economic costs, investing in nutrition intervention has been identified as one of the most cost-effective and efficient way to improve life and livelihoods of citizens and achieve and sustain economic well-being of nation. Excellencies, ladies and gentlemen, indeed, nutrition investment have a high benefit to cost ratio. The International Food Policy Research Institute has estimated that every $1 investment in preventing malnutrition delivers $16 in net social benefits. Yet investment in nutrition currently falls far short of the need. The 2021 Global Nutrition Report estimated that nutrition-specific financing needs to meet maternal, infant, and young children nutrition targets were $10.8 billion per year over 2022 to 2030. And nutrition-sensitive needs were estimated at $39 to 50 billion per year. While major summits like Nutrition for Growth have helped to increase attention paid to nutrition financing, in some countries, domestic nutrition budget allocation have been increasing, investment in nutrition still lag far behind what is needed. For instance, in the case of Ethiopia, the total investment gap for nutrition and food strategy stands at 50%. Excellencies, ladies and gentlemen, the government of Ethiopia has shown its strong commitment to sustainable financing for nutrition and improving food and nutrition security of citizens. As part of this National Development Agenda, the government of Ethiopia is implementing several strategies and programs to ensure food and nutrition security over the past decade, including the Food and Nutrition Policy, Food and Nutrition Strategy, the Sekota Declaration, the Food System Transformation Roadmap, just to mention a few of them. This has enabled the government to sustainably reduce the burden of malnutrition. For instance, in the past 2 decades, as most of the speakers have rightly mentioned before me, we have been able to reduce the national stunting prevalence from 58% to 39%. Though there is a promising progress, the annual rate of reduction is not enough to meet the targets set nationally, continentally, and also globally. Recognize that most of the nations globally, and in particular in Africa, are not on track to meet the targets set to meet the World Health Assembly. In this regard, more political and financial commitment is needed to bring these targets back on track. Excellencies, ladies and gentlemen, a critical component for the success of nutrition programming is securing the required resources to implement activities at a proposed scale and coverage to achieve the set targets. The interventions designed to achieve the food nutrition security goals outlined in the 15 years roadmap of the Sekota Declaration and a costed Warada-based plans will require significant resource mobilization and a sharp increase in funding for the remaining years of the expansion and scale-up phases. Taking this into account, a resource mobilization plan that has been developed presents a set of partner actions to support the sustainable financing goals of the Sekota Declaration. In the past years, the government of Ethiopia has sustained its financial commitment for Sekota Declaration from its treasury budget since it was launched 15 years back. Since it launched the first phase of the 15 years roadmap, which is called the innovation phase. This commitment has been sustained irrespective of the global and national challenges such as COVID-19, food price inflation, conflict and climate change, droughts, floods, and locust infestation. For this Ethiopian fiscal year alone, which is the third year of the second phase of the 15 years commitment called the expansion phase, the government have made an allocation of 697 million Ethiopian birr, which is equivalent to 10.9 million USD from its treasury. Impact studies conducted to assess the progress we made in the past 2 years has showed that there is a positive trajectory in averting child stunting in the 240 operational districts. In the first year of the expansion phase, which is 2021, over 59,770 children were averted from stunting and 2,904 children were prevented from deaths according to EPHI and IFPRI study. In 2022, which is the second year of the expansion phase, the Sekota Declaration implementation enabled us to avert 99,080 children from stunting and 3,033 children from deaths based on the Johns Hopkins University impact analysis study. We achieved this while the implementation is short of the required investment to meet the annual financial need. If we had the full investment, this impact would have been doubled or tripled. Excellencies, ladies and gentlemen, to meet the investment need for the Sekota Declaration, we have developed the Sekota Declaration Resource Mobilization Plan, which provides programmatic and strategic guidance to decision makers, donors, and development partners on ensuring sustainable financing for the implementation of Sekota Declaration, expansion, and scale-up phases. The Sekota Declaration Resource Mobilization Plan will enable us to strengthen multi-sectoral financial management for improved nutrition outcomes, evidence-based decision-making, increase sustainable funding sources by engaging with existing and new and innovative stakeholders, and mobilize about 6.86 billion USD over the next 8 years to finance the expansion and scale-up phases interventions. Excellencies, ladies and gentlemen, in Ethiopia, food and nutrition programs are funded through various sources and channels, and as a result, there is no one mechanism that manages all financing holistically. The government contributes significant funding to the Sekota Declaration each year through the Treasury budget and regional matching fund allocations. This is planned and spent by Waradas for priority nutrition specific, nutrition sensitive, and nutrition smart infrastructure interventions. However, it's so challenging to see the full financing picture, especially when most funding for nutrition is channeled directly to implementing partners and they are off budgets. In this regard, we have developed and are using innovative tools to strengthen planning and budgetary tracking for nutrition. Excellencies, ladies and gentlemen, as I conclude, I would like to call upon all stakeholders to utilize the resource mobilization plan to make your investment decision and to consider the co-financing of the government investment for successful implementation of the Sokotra Declaration expansion and scale-up phases. The government is committed and will sustain its commitment to achieve the funding needs set in the resource mobilization plan. I thank you, and the event, side event is officially open. Thank you very much.
Thank you, Your Excellency, for that very, very eloquent and substantive message that you've delivered to us. I won't even attempt to summarize it because we'll have the full statement shared with everyone. But I really think the clearly demonstrating again that socioeconomic impact and consequences of malnutrition, stunting, and all to our GDPs is clearly something that we really must be concerned about and addressed. And I think we've heard it coming across from different speakers. The investment gaps, I mean, despite the enormous effort the government is making, there are still a huge investment gaps. And again, that's why we are having this high-level event to bring to their attention the necessity of bringing more partners to support member states in their efforts for food and nutrition security in our member states. The innovative tools, the importance of planning to tackle this upfront and not as a side issue, I think is really something that hopefully we'll hear more of it. We did skip one of our high-level speakers, the representative from COMESA. Perhaps because I think the minister has formally opened the event, so I will appeal to my colleague who will be moderating the next session to call on the representative of COMESA to make his keynote, his address before the panel discussion starts. So I really want to thank all the high-level speakers for their intervention. Perhaps we can give them another big hand. For me, it's always important to have these sessions because we are hearing from our political leadership. We can have the best experts in the room, but if there's no political will to drive and change policies and give the right budgetary allocations and create the space for engagement with the different actors, we will not make much progress. So we need this time to hear from our political leaders, and the passion that we've heard from all of them is a clear indication of the importance of this subject and their political commitment to place this matter, this issue, at the height of the political agenda of our member states, but also as it is at the level of the continent now, an integral part of the implementation of Agenda 2063. And we believe that the second 10-year implementation plan through CADAP and all the sectoral plans and policies will harness the work that we have done the last 20 years in CADAP in nutrition and make it even much more an important topic in the discourse on the political agenda of our member states, but more importantly on the development programs that we implement at the level of our countries and the continent. We must make sure that nutrition security is at the core of whatever we do. With that said, thank you again so much. I think I just want to invite those who will be part of a press conference. I think Kifiwe and the other colleagues will guide you to where this will take place, but please, all the other participants should stay in the room so that we can continue. We have lost a bit of time because we started a bit late. So I will invite my colleague, Dr. Nalkomo Kovic, the Director General and representative of the CGI to Ethiopia, to come and moderate the next session. Thank you so much for your attention and participation.
Thank you very much. I think we are going to get into a panel, but I have been given an assignment. So let's start first by hearing from Dr. Mohammed Kada, who is the COMESA Assistant Secretary General, if he's in the room. Thank you very much.
Good morning, everyone. Well, I guess we're all sleep deprived somehow, so I take no offense. Your Excellency, Honorable Minister, State Minister of Health of Ethiopia, Honorable former Minister of Health of Ethiopia, ladies and gentlemen. I'm honored to be part of this high-level side event on achieving nutrition goals in Africa post-Malabo, public and private sector sustainable financing. I would like to thank NEPAD for organizing this important side event and inviting the COMESA Secretariat to be part of it. Honorable Ministers, Excellencies, ladies and gentlemen, as a continent, Africa continues to make progress in addressing the problems of malnutrition. Over the last decade, African countries have developed and implemented initiatives to improve nutrition and food security. However, progress in reducing malnutrition has been slow. Malnutrition in all its forms, namely undernutrition, overnutrition, and micronutrient deficiency, continues to be a worrisome problem on the continent, with compounding effects on both individual and societal development in terms of lost productivity and GDP, in addition to its humanitarian toll. Furthermore, multiple shocks, including the impact of COVID-19, pandemic plus climate change and debt burdens, conflict within the continent, the Russia-Ukraine war, and declining official development assistance, have exacerbated the situation and put the Malabo goals, Agenda 2063, and Sustainable Development Goal 2 on zero hunger further out of reach. Various studies show that investments in nutrition can be a strong stimulus to achieving a range of development goals and combating these shocks. As the Honorable Minister quoted and put it, every $1 US dollar in preventing malnutrition is estimated to reflect a net increase of $16 in net benefits. Honorable Ministers, ladies and gentlemen, fast-tracking the achievement of nutrition and food security goals that Africa needs requires accelerated progress for nutrition financing across all sources, including the private sector. National governments are responsible for ensuring food security, health, stable and dignified livelihoods for their populations. Therefore, national governments are required to assume leadership, provide an enabling environment for sustainable investment in nutrition, and enhance public and private sector sustainable nutrition partnerships. Our governments should strive to ensure that progress and progressive policies and fiscal incentives are put in place to develop appropriate institutional frameworks for coordinated action among all stakeholders and across sectors to ensure financing efficiency, effectiveness, and greater impact on nutrition outcomes. In particular, private sector contribution can be promoted through appropriate schemes such as tax incentives to invest in nutrition. In addition, private sector players have a critical role to play in nutrition financing through social corporate responsibility and investment in transforming food systems and enhancing access to healthy, nutrient-rich, affordable, and sustainable produced foods. Before we reach out to our development partners, Africa should first and foremost internally do its best to leverage more domestic resources to finance nutrition and food security agenda and help build community resilience and well-being. It is crucial that investments in nutrition take into consideration the interconnected nature of agriculture, nutrition, education, and overall development. Thus, the need to effectively utilize the limited resources available across key nutrition-relevant sectors and ministries. This then calls for greater mainstreaming of nutrition-related activities within governmental annual planning and budgeting, as well as maximizing existing sources of financing, including bilateral aid and development finance instruments. It also entails harnessing new sources of financing, such as green investment and new innovative finance tools for nutrition. Furthermore, we need to devise cost-effective interventions that can be delivered quickly, easily, and scaled up for greater impact. Honorable Ministers, ladies and gentlemen, there is no doubt that our governments cannot tackle the challenge of malnutrition and food insecurity on their own. This is why we need to promote public-private partnerships and collaboration, including joint ventures, technology and skills transfer, and investment in nutrition-sensitive interventions across agriculture, health, water, sanitation, hygiene, infrastructure, and other sectors. We particularly need to improve smallholders producers' access to better production inputs, improve technologies and services, including financial services, by reducing or at least by removing or at least reducing key barriers to access to these services in order to enhance productivity, production, and incomes. The COMESA Secretariat recognizes the dire challenge of food security on the continent and works with its member states, development partners, the African Union Commission, EU-NEPAD, and other stakeholders to face this challenge through capacity building, technical assistance, and evidence-based policy reforms for improved nutrition and food security. In brief, all stakeholders need to join hands to help achieve the Malabo goals, including African governments, the African Union, regional economic communities, the private sector, development partners, technical agencies, and the civil society. Your Excellencies, as I conclude, it's my hope that the outcomes of this engagement on public and private sector sustainable financing for improved nutrition in the continent will inform the Post-Malabo Agenda and ensure it's fit for the future. I thank you very much.
Thank you very much. In my enthusiasm to take on the assignment I was given by Madame Esterine, I completely neglected to rise on the protocols that had already been observed. So Your Excellencies in the room, distinguished guests, I do now rise on the protocols that have already been observed. We have heard a lot from the different speakers, and really the key messages for us are that investment in nutrition is investment in a lot of things. It's investment in health, in education, in economic development. It is even a catalyst to diversifying our agriculture and food systems. It is one that can help us grow our economies. If lack of investment in nutrition drains our annual GDPs, then investment in nutrition is something that we must do. And so we are here for this technical panel. At first we'll have a presentation. Really the objective, the key objective of what we are going to go through now is to share experiences. We have indicated it's important to invest in nutrition. That requires us looking at different ways of financing nutrition. And so today we will hear from different country experiences of how they are going about mobilizing and financing nutrition in different ways for different contexts. We will start with first a case study from Ethiopia on the Sokoto Declaration, which is a government commitment not to reduce stunting, but to end stunting by 2030 for under 2-year-olds. Quite an extensive resource mobilization plan, very supported by government from National Treasury, has been developed. And so I now call upon Dr. Sise Senamo, who is the Senior Program Manager, Sokoto Declaration for the Federal Program Delivery Unit, and also the Sun Focal Point, to share with us this experience of a resource mobilization plan in Ethiopia. Over to you, Dr. Sise.
Good morning all. Ladies and gentlemen, Excellencies, all protocols are observed. I will be sharing this resource mobilization plan for the expansion and scale-up phases. Just to give you a little bit background, the Sokoto Declaration is the Government of Ethiopia's commitment to end stunting among children under 2 years by the year 2030. This declaration builds on and accelerates the implementation of the existing food and nutrition strategy in Ethiopia. When we do the launching, the government has made a commitment to prevent over 7.8 million children under 2 years in 15 years' time. This declaration was launched back in 2015. The Sokoto Declaration strategy consists of a number of sectors working together to achieve the ending stunting goal. Currently, 14 sector ministries are working together, including health, agriculture, water and energy, education, women and social affairs, transport, irrigation, planning, innovation and technology, finance, trade, disaster risk management, and industry, as well as also urban and also infrastructure ministries. So these ministries are governed by the highest level of the government in Ethiopia, and they are also working together under the interministerial steering committee. We have also tested 6 innovations during the innovation phase, and now we have added additional 4 innovations to make 6 innovations. Some of them are already proven, tested, and we are now scaling up. The others are also, we are also, testing and also learning by doing approach to scale up during the expansion phase. As you can see on the roadmap, the 15 years roadmap is divided into 3 phases. We started with 40 waradas during the innovation phase, which is learning by doing. After generating the impact during the innovation phase, we have now expanded into 240 waradas. Currently, the program is operational on the 3rd year of the expansion phase. And last January 1st, 2024, the government has approved to expand to additional waradas to make 700 waradas in the coming 3 years. And the scale-up phase will be started as of 2026. When we look at the innovation phase that we have generated the impact, the evaluation of the Sokoto Declaration innovation phase in 40 waradas has clearly showed us a very strong pathway for reducing stunting and also saving life. We did the impact evaluation by the end of 2020, and it has clearly shown us, the result has shown us a stunting reduction in one of the regions, which is called Tigray, reduced from 40% to 32%, and also in Amhara region from 41% to 42%. On average, 3 annual average rate of reduction of stunting, which is a massive reduction in terms of stunting. So based on this evidence base generated in the 40 waradas, the government has made a decision in 2020 to expand the Sokoto Declaration waradas into 240 waradas, where over 27 million people and over 1 million pregnant lactating women and also over 2.2 million children under 2 years will be served through this program. So the expansion phase this year is the 3rd year, but the last 2 years of implementation, we have also reviewed how we are making a difference in terms of impact of the last 2 years. In the year 2021, we did the impact assessment with EPHI and IFPRI, and as His Excellency alluded earlier, we have been able to avert over 59,000 children from stunting through 1 year multi-sectoral high-impact nutrition-specific, nutrition-sensitive, and infrastructure interventions. Last year, we also did an impact study with Johns Hopkins University, and close to 100,000 children have been also prevented from stunting. So based on this evidence, the government has made a decision to expand the expansion phase waradas also from 240 to 700 in the coming years. If we really expand our impact, the high impact intervention coverage, and also the investment to achieve that interventions, by the year 2030, we aim to prevent over 5.6 million children from stunting. So this is very close to the 15 years ambitious plan that we have in the Sokoto Declaration, and if we make more investment, more high impact interventions coverage, and also if we expand during the scale up additional geographic areas, we will be able to prevent this number of children. So in terms of investment, the last 2 years investment is gradually growing. This is an investment that has been made from the federal government in 2014, which is our calendar, in 2021, 2022, which is around 10 million. We have been also contributing from the regional governments around 3 million USD, and a total of around 13 million investment, including development partners investment, has been made in the first year. In the second year of implementation, which is 2022-2023, this investment has grown both from the federal government as well as from the regional government, and also development partners investment has also grown, making the last year investment around 20 million USD. So based on this baseline target, we have developed the resource mobilization plan for the upcoming 8 years. So this investment consists of both the government allocation from the treasury resources, and also the government managed external funding allocations, and also the off-budget allocation from the external partners. So during the expansion phase, we expect more from off-budget allocation, but as the caseload decreases and more investment comes from the federal and also regional government match, the overall government managed external funding will increase as the year continues from 2026 onwards. So in summary, the annual investment need for the Secota Declaration, this is how we have developed. The federal government will make 3 billion Ethiopian birr, which is equivalently matched by the regional government. This is going to be additional 6 billion Ethiopian birr, which is 189 million USD. And we expect also our development partners to match the government financing allocation. I think traditionally, what we are asking is development partners will bring resources and ask the government to match. But now we are also, changing the narrative. If we invest this amount of investment, could also development partners could contribute an equivalent amount to make a maximum investment and prevent those number of figures that we have indicated in the projection in the coming 8 years. So in summary, the Secota Declaration investment plan, or resource mobilization plan, has 3 strategic goals. The first one is strengthening the multi-sectoral financial management for nutrition. I think there are many investments for nutrition, but this investment is not well tracked because most of the investments go off government budget, managed budget allocation. So we will be using the resource tracking partnership management tools, the UNIS tools, the Triangle of Knowledge partnership, as well as also building, strengthening the financing capacity at Warada level to track the existing investment, as well as also to track the impact of those investments. The second goal is to increase sustainable funding sources for the Secota Declaration. In terms of this, we will be supporting the existing multi-sectoral nutrition fund through the treasury allocation. The government will sustain this allocation. And also creation of a new multi-sectoral pool funding mechanisms, like we have the One Wash. And the other option is the implementing Waradas and partners directly to access funding, like we did through the G10 program, through the grant under grant arrangement, where Waradas will apply for funding and also they receive funding for the implementation. The other option is also to have a call for proposal for the community-based organizations to receive funding, and also engaging the private sectors and also funding the implementing partners directly, but that budget could also be tracked so that we know that how much investment is going for the implementation. The third goal is to mobilize the resources to finance the expansion and scale-up phases. Over the next 3 years, it is expected to commit funding for the expansion phase, and also we need to mobilize additional resources to meet the 189 million USD investment that will come both from the federal, regional government, which will also be equivalently matched by the regional government. So this is 3 Secota Declaration resource mobilization sustainable financing goals. We'll be implementing this in the coming 8 years until the end of the expansion phase to make sure that we receive adequate financing for the Sakota Declaration implementation and meet the goals that we set for ending stunting. I thank you.
Thank you very much, Dr. Sise. If I can ask for support to bring the chairs for the panel on the stage. And then in the meantime, that is an example of what is happening in Ethiopia in terms of leveraging government funding to be able to ask for resources from development partners. Of really interest is this changing the narrative of, instead of development partners coming to say, here's what we've got, match us, it's the other way around, where government says, here is what we've got, what we are putting forward, you want to help us, match us. So that narrative, I think, is an important aspect. We all know that we really need to up the game in terms of investing in nutrition. The needs are plenty, and so it is extremely important that we think of different ways in which we can actually finance nutrition, but not short-term funding. It should be thinking about how we can consistently fund nutrition. And that will happen only when governments take up that goal and actually begin to develop what we have seen now as an example from Ethiopia, a whole resource mobilization strategy led by the country itself with funding from National Treasury. So this brings us to the panel, which is now to share experiences from the efforts that are being done in different countries. So first I would like to call to the stage Mrs. Chito Nelson. If you can come forward, please. Thank you. Mrs. Chito Nelson, as she comes up, is the Deputy Director, Head of Food and Nutrition Division for the Department of Social Development for the Federal Ministry of Budget and Economic Planning in Nigeria. Then next I call Mr. Blessing Muwalo. Thank you, sir. If you can give him a round of applause as he comes up. Mr. Muwalo is Deputy Director of Nutrition at the Ministry of Health, Department of Nutrition in Malawi. Then next we have Mrs. Mary Mpere. There she comes. Mrs. Mpere is Technical Advisor, Food Systems and Nutrition Security, National Development Planning Commission in Ghana. Then we have Dr. Patricia Ngoran, and here she comes. Advisor to the President of the Republic of Cote d'Ivoire, and also the Sun Focal Point for that. I believe she's also representative for Sun for West Africa, for Francophone Africa, right? Then we will have Ms. Prudence Mavumbi. She's going to be online, and she will speak there. And she's the Director of Agriculture and Industry for COMESA. Now, dear panelists, we have heard the fact that it really requires some effort to mobilize enough resources, and you have diverse experiences to share with us. So if I can start with you, Ms. Nelson, what strategies worked well to increase financing on nutrition specifically at state level in Nigeria. I'm emphasizing state level because of Nigeria being a federal country with multiple regions. So over to you, ma'am.
Thank you. Good morning, and permit me to stand on the already established protocols. Like she said, Nigeria runs a federation, and we have 36 states plus the Federal Capital Territory. So for funding for nutrition has been a challenge, and for us to get over some of these things, we've started looking at the area of establishing and setting up nutrition sustainable financing frameworks for the states, in which the states look inwards, aside from the traditional funds that will come from the federal and from the state, but for them to look inwards to see other sources of fundings from the states. And this we've done collaboratively with Results for Development, with the World Bank, and with the Nigerian Governors Forum that works closely with the states. So we've developed this framework, sustainable development financing framework for the states. And from what we've seen, the private sector has a critical role to play, and the states are working to ensure that they are able to get money from the private sector. And we've seen states establishing nutrition trust funds, and these are not from the budget. They are off-budget things that companies, big companies that are in the states are now willing to support nutrition. And this is also based on the fact that the states, they have a costed plan, and because they have a costed plan that clearly shows what every sector can do, the government, the private sector, and everybody involved. So it makes it easier for the private sector to come in and to handle some aspects of this issue. And also, we've also established a system of budget tagging within the states, so that as nutrition investments are made, we are closely looking at it and monitoring how the funds are being expended. And we've gone ahead to support the states to domesticate the resource mobilization strategies that has been developed at the federal level, and building the capacity of the state officials to be able to adapt and learn how to use the optimal tools, so that they get the best buy from the available money they have in the states. So thank you.
Thank you very much. Yeah, trust funds from private sector, isn't that an innovative idea? I think it's a very useful one. So over to Mr. Muwale. How have districts in Malawi strengthened budgeting planning for nutrition across the sector? This is specifically for districts this time. Thank you. Over to you.
Thank you very much. To begin with, to sustain budgets and planning in the districts, we needed documents. And I cannot just go straight to the district documents without telling you about the national level documents we have, because they all relate to each other. So to begin with, at national level, we have the National Multi-Sector Nutrition Policy. And mind you, in Malawi, we have a decentralized type of government where we have the national level, then straight from national level to the district. So at national level, we have the National Multi-Sector Nutrition Policy and the strategic plan, and the strategic plan is costed. So too, we have in this policy, we have key interventions that are costed. We have an implementation structure. We have required personnel that is required, and we have the monitoring and evaluation framework. We have also the resource mobilization strategy, which is of course a draft, but we still use it. And these are the documents we have taken straight to the district, for the district to streamline and come up with their own related documents. You know, districts have got different, varying requirements nutritionally. So there's no way every district in Malawi can have the same type of plan. They have different plans, but their plans are aligned to the policy. So having done this, we also realized that we needed the personnel at district level, the frontline personnel to implement, which we didn't have and we still don't have. And again, at district level, the districts were relying much on donor support. Now we needed the government to come in because the donor support alone cannot support nutrition activities. So we had a chance when we were launching SAN 3.0 that we had an interface with the president himself. And we presented our case to the president to say we don't have frontline staff, we don't have a budget in nutrition, and he gave a directive instantly to say there be a budget in nutrition and its frontline staff should be recruited. So after that, we engaged the local government financing committee, and we have a vote in nutrition in every council. And the government is putting funds to that vote. Having government putting funds in that vote, it attracted donor support, and most of the donors came in to support the budgets at local government. So what we have done is we have distributed the districts according to the donors. You can have UNICEF having 3 districts or 4 districts, or the bank other districts, or division and so forth. So the donor partners, the non-state actors have been given districts to look after, and they have budgets which they support with the documents the district drafted, the costed documents, then they are supporting the budgets. But however, we had a challenge where some districts, although oriented to the national strategies, they didn't adhere to that. So we had our partner, Results for Development, who came in to do some assessments. And we have done those assessments, and we have come up with some recommendations which we have used to change our policy and strategies. And meanwhile, we have drafted a vibrant monitoring and evaluation system because of those recommendations. And again, we have a national nutrition information system which we are using, which we have drafted based on the findings of Results for Development. And this is in a draft form as well, but we have already started using it. So it's very helpful if we were to do these assessments throughout the districts, as Results for Development has done, then come up with good information that can be featured into the policy we are reviewing. I think this can be very helpful.
Okay. Thank you very much. It sounds like a lot that has been done. I particularly like the idea of having donors, specific donors adopting districts and being associated with that. Before I move on to the next panelist, I would like to recognize the presence now of His Excellency Ato Demeke Mekonnen, who is former Deputy Prime Minister of Foreign Affairs. Is he here? Thank you, Your Excellency. And then let's move on to the next speaker, who is going to be Mrs. Mary Pere from Ghana. How can medium-term development plans be utilized to increase nutrition finance? Medium-term planning is an interesting one because normally we planned and then we are in the middle, right? So how do you leverage that for nutrition financing based on your experience?
Thank you very much. Good morning, everybody. All protocols observed. In Ghana, when we joined the SAN movement, we took a very critical decision that we wanted to see ownership, accountability, and sustainability for nutrition financing. And therefore, we anchored everything
I ask you to
on
move your
country
microphone
systems.
a bit closer.
Yes. We anchored everything on country systems. So we mainstreamed nutrition into our national development policy frameworks, both long and medium term, into our plan sector and district plans. We also looked at the budget, influencing the budget so that nutrition, once you plan well, of course, you are going to make sure that the budget reflects whatever interventions that you have. So we paid attention to the budget, and we also looked at monitoring and evaluation frameworks. For instance, if you do not have a plan, If an intervention is not in a plan, there is no way you can attract government funding. Our public financial management system ensures that happens. And so costed medium-term development plans, whether at district or sector level, constitute the bedrock for our medium-term expenditure frameworks, and therefore, and also annual planning and budgeting. And so that is why in following country systems, every sector, every district has to have a plan in place. It didn't come easy. We had to build capacity because there are some sectors that traditionally plan for aspects of nutrition, others don't. So we had to commission issue papers for nutrition sensitive sectors like education, social protection, and WASH. We also had to revamp multi-stakeholder platforms at the district level to ensure that they do joint planning and programming. And we also developed a toolkit that takes them through how to plan for nutrition, from the analysis to objectives, to strategies, to budgets, to monitoring and evaluation framework, or especially with indicators. And the results were fascinating because sectors that hitherto did not see themselves in the picture as far as nutrition planning was concerned now began to reflect them in their policies and in their plans. At the local level, with some work that we did with R4D, it was interesting that districts that even claimed that they were already planning for nutrition, after training them with the toolkit and then also with the resource mobilization, the nutrition financing framework that with, with the help of R4D, USAID actually helped with the toolkit for mainstreaming. And so after that, we realized that the nutrition budgets actually increased from 10% to 34%, which meant that the capacity building actually made for better nutrition planning and therefore also better budgeting. Even though we acknowledge that the costed medium-term plans are the bedrock for our medium-term expenditure frameworks and therefore annual planning and budgeting for nutrition, and therefore to using that to leverage the resources that we need, especially government resources and even donor resources at some point, because what we encourage donors to do is to plan their programs, align their programs with our national medium-term development policy frameworks. And therefore, once that alignment is there, you can be sure that they'll find themselves supporting priority nutrition budgets.
So that's really nice. What I really like from what you have shared is introducing this idea of flexibility mid-term in the budget cycle. The other one I think that I really like is on the capacity development provided to actually ensure that the people that can actually develop those plans and bring nutrition budget into effect are able to, and congratulations for the, 10% to 30% is not a small feat for nutrition, so congratulations for that. Yeah. I would like now to move to Dr. Patricia Ngoram from Cote d'Ivoire. She's going to speak in French, so you have these gadgets on your tables, so if you can put those on. Dr. Patricia, over to you. So your question, wait a minute. Your question is, what are some of the challenges that Francophone African countries face to alleviate, to be able to elevate nutrition financing? Over to you.
Merci. Je voudrais remercier ici les autorités du pays qui nous accueillent, c'est important, et les organisateurs et l'ensemble des partenaires ici présents. Et je voudrais aussi, au nom des pays francophones, des pays seuls francophones, pouvoir restituer l'ensemble des échanges que nous avons eus et traduire fidèlement les défis qu'ils rencontrent. Je voudrais dire que la plupart des pays francophones seuls ont institutionnalisé la nutrition avec des niveaux d'ancrage différents, soit à la présidence de la République, soit à la primature, soit à la santé. Ils disposent tous de plans multisectoriels budgétisés et une coordination multisectorielle. Cependant, la mise en œuvre des politiques sectorielles et multisectorielles, parce qu'il y a d'autres encore qui ont des politiques sectorielles, et multisectorielles souffrent toujours d'un manque de financement ainsi que d'une gouvernance nutritionnelle de qualité. Alors pourquoi? Donc les défis à l'accroissement, selon les pays et selon l'ancrage, c'est différent. Mais je voudrais résumer en ces points. 1, c'est une question de priorité. Alors comment faire? Il se pose la question, comment faire de la nutrition une priorité des priorités lorsque la plupart des pays font face à de nombreux défis. Permettez-moi de m'arrêter sur le Niger qui disait il y a au moins 8 ans, 10 ans en arrière, j'ai aimé cette phrase. Il a dit, c'est vrai, vous nous citez en exemple les 3 Z, mais on a tellement de défis que je ne peux pas garantir la durabilité de ce que nous avons fait. Aujourd'hui, vous pouvez constater les 3 Z, ce que c'est devenu. Il y a une volonté politique, mais quand il y a de nombreux défis, comment faire de la nutrition une priorité des priorités. Ensuite, c'est l'institutionnalisation de la nutrition, surtout le niveau d'ancrage qui ne facilite pas la prise des décisions pour une allocation suffisante des ressources. Comme j'aime le dire, parfois on pense c'est le ministre des Finances, mais non, moi je suis passée par la santé, par la primature, par la présidence, et je peux vous dire, plus vous élevez l'ancrage, ce n'est pas une affaire du ministre des Finances, c'est une instruction qui est donnée par la plus haute autorité et que le ministre des Finances exécute. Ensuite, il est ressorti qu'il y a encore une confusion entre la sécurité et la nutrition, qui fait que c'est une difficulté pour allouer les financements à la nutrition. L'appropriation insuffisante par les décideurs politiques à tous les niveaux de la politique nationale et son plan multisectoriel avec ses conséquences sur l'allocation des ressources. Faible mécanisme de coordination qui impacte bien sûr sur l'optimisation des ressources et leur utilisation. Pour certains pays, il y a l'inexistence de lignes budgétaires dédiées à la nutrition. Et pour certains, le financement est fait en grande partie par les partenaires. L'État n'attribue pas de financement, mais pour dire que même ces financements, dans certains pays, sont alloués seulement à la prise en charge de la malnutrition, surtout la malnutrition aiguë sévère. Il a été noté une insuffisance, voire inexistence de mécanismes de traçage des investissements, surtout dans les secteurs sensibles à la nutrition, une faible coordination des partenaires financiers, malgré l'existence de réseaux de partenaires pour la nutrition, non-alignement des partenaires avec une fragmentation des efforts, des financements, pour eux c'est des gaspillages des ressources et une inefficacité dans la mise en œuvre. La contrainte en termes de capacité de ressources, compétences dans le pays au niveau national, au niveau opérationnel et qui fait que la mobilisation, la programmation budgétaire en souffre. En conclusion, je voudrais dire, la multisectorialité implique des investissements constants dans tous les secteurs. Si on a désigné un secteur comme étant un déterminant de la malnutrition, on doit investir dans tous les secteurs. Et pour cela, les pays demandent de faire une réflexion profonde et courageuse sur l'ancrage. Aujourd'hui, il est temps de dire où est le meilleur ancrage pour que chacun s'y mette. Et pour cela, ils invitent à une évaluation de la mise en place et la fonctionnalité des mécanismes institutionnels de gouvernance de la nutrition et leur contribution à la pérennisation des acquis. Aussi, ils souhaiteraient plus d'évidence. C'est vrai qu'ils ont fait le coup de l'inaction en matière de sous-nutrition infantile, mais à l'intérieur, même pas pour l'anémie, l'impact de l'anémie. Le profil à l'époque a pu permettre d'avoir l'impact de l'anémie. Nous savons tous, les pays de l'Afrique de l'Ouest souffrent énormément de l'anémie. Ils souhaiteraient aussi que dans le coût de l'inaction soit introduit également le surpoids, l'obésité, les maladies non transmissibles. Et ils voudraient aussi inscrire les financements dans la durabilité et pour cela, il est temps de définir un objectif de financement domestique réalisable. Je dis réalisable parce qu'on a déjà eu porté des réflexions. On a entendu 15% du budget de l'État, ça, on va tous échouer. Parce que ces secteurs ont déjà un objectif de financement, que vous prenez l'agriculture, l'éducation, la santé, et j'en passe. Alors si on s'en va demander encore 15% du budget de l'État, je vous dis ça ne va pas marcher. Il vaut mieux réfléchir, c'est quoi le financement que les États doivent allouer à la nutrition. Et je ne pense pas que ce soit aussi énorme. Il demande l'implication du secteur privé. Et pour terminer, c'est la cible, une cible claire. On nous attend pour 2030. Sur quoi on nous attend? Éliminer toutes les formes de malnutrition. C'est quoi éliminer la faim? C'est quoi la cible? Vous voyez, on va après Malabo, post-Malabo. Regardons les indicateurs que nous sommes fixés pour Malabo. Est-ce que c'était assez objectif? Aucun pays ne pourra l'atteindre. Donc c'est quoi éliminer toutes les formes de la malnutrition? Il souhaiterait que tous les États soient impliqués dans cette définition, mais ce n'est pas une définition des objectifs qui nous soit imposée. Que chacun puisse s'exprimer dans les objectifs. Je vous dis merci.
Merci beaucoup. Je vous remercie. I think a lot of issues there. Sustainability is important. We shouldn't wait for crises to address malnutrition, which means investment in prevention is even better. And I think that means it actually lends well to everything else that has been said in terms of looking at district plans, looking at moving to regional level, having proper plans as well. So I would like to move online now to Ms. Prudence Mavubi. Ms. Prudence Mavubi is Director of Agriculture and Industry at COMESA. The question I have to you, Ma'am, is how can private sector investments be leveraged to support financing for nutrition programs? Over to you.
Thank you, Madam Moderator. Please confirm if you can hear me.
Can, thank you very much.
Thank you. Allow me to write on the existing protocol and to dive directly to address the question that has been raised to me. First of all, let me emphasize that private sector, including small-scale farmers, food processors, distributors, and large-scale manufacturers, have a direct impact on food security and good nutrition. If we are to leverage on their investment, we need to come up with innovative mechanisms, as some of the previous panelists have highlighted, on how we work with them to achieve nutrition objective. From the government perspective, we need to really make sure that we create an enabling business environment to attract private investment and entrepreneurial activities that deliver on nutrition outcome. Beyond having that an enabling environment, as a former panelist said, we need to also engage them in the planning as we plan for our nutritional plan. As we communicate, we need to really engage with them so that we are on the same board and we have mutual benefit that we are trying to address. Secondly, there is a participant who said that we need to have public-private partnership. Yes, these models need to come with appropriate institution and financing arrangement that can help leverage on private sector investment to support nutrition-sensitive intervention. We are not going to ask government to put in more money in this, but we can leverage on the investment that the private sector are doing through a very innovative and public-private partnership. We need also to look at mobilizing joint financial resources so that partnership is done in a more clear and way of fostering scalability, sustainability, and inclusive on nutrition outcome. We also need to support smallholder food producer and farmers to access better production input and technology through smart subsidies to boost their productivity and production. This also will require that we connect the smallholder farmers to competitive market in order to catalyze their investment in agriculture and food system. We need also to decisively deal with issue to do with barrier to agri-food trade, particularly addressing issue of non-tariff barrier to boost cross-border or regional trade and incentivize agribusiness to invest in agriculture and agri-food value chain. Last but not the least, we need to put a lot of effort to support the provision of real-time data on food production, trade and consumption, as well as investment opportunity to inform private sector investment and policy decision that can enhance the realization of food security and nutrition. With that, I submit, Madam Moderator. Thank you.
Thank you very much. Now, this is where trouble usually comes for moderators. Time is never on our side. I want to give you an opportunity to make a statement. And for your statement, imagine that all the other countries in this room can come to your country to learn. So in one statement, what's the one thing when they come to visit you that you say, if nothing else, here is the lesson that I want you to take from my country? Just a statement. What's that big lesson you want to share with the other countries that should make them come to Ghana, come to Malawi, come to Nigeria, come to Cote d'Ivoire and say, this is what you can learn from me? Starting with you, Ms. Nelson.
Yes, thank you very much. I think that the capacity of program officers need to be built on budget management, as well as for them to understand what goes on in the physical space at both the states and at the federal level. It will help a lot to guide them in programming and for fighting and defending their budgets.
Thank you. Your statement from Malawi, what must we come and learn in Lilongwe?
Yeah, first they will learn that for you to get funding, you have to have costed documents for implementation. You have to have adequate personnel to implement. Then you have to have political will from the highest level. Then you have also to have input from the government. Then the donors will be now influenced to also put in some money for you to implement nutrition activities. Otherwise, if you don't have costed documents, there is no way you will influence donors to join you because there is no budget to support. They will ask you, what is it that you want us to support?
Thank you very much. So, costed document, very important. And when we come to Ghana?
It's very important to know your country's system, especially the planning and budgeting system.
Move your microphone closer.
Yes, and capacity building is critical. Capacity building and evidence-based advocacy so that you can continue to improve on nutrition financing over the years. Thank you.
Merci.
Come to Côte d'Ivoire.
Merci. Alors si je devais partager l'exemple de la Côte d'Ivoire, j'allais dire simplement, comme tout le monde le sait, l'ancrage de la nutrition à la présidence de la République. Nous venons de faire un nouveau plan. Ça a été une instruction du président de la République de dire au ministre du Budget, c'est pour ça que je vous le disais, de prendre action maintenant et de voir la contribution de l'État qui est de 15% du coût global du plan multisectoriel, pas du budget de l'État. Et aussi nous allouons 20% à travers des projets d'investissement auprès de donateurs. Je voudrais aussi, si j'avais à partager, c'est l'institutionnalisation de la nutrition dans le secteur. Pour une meilleure appropriation, on va avec plusieurs secteurs. Ils ne se sentent pas toujours concernés. Il faut institutionnaliser dans ce secteur, le rendre redevable et aussi participer à la mobilisation des ressources. Pour dire aussi, la meilleure pratique, c'est l'inscription des financements du plan dans le programme d'investissement public. Tant que vous ne l'avez pas inscrit, vous n'avez pas une nomenclature budgétaire, vous n'avez pas de ligne budgétaire, on ne pourra pas avancer. Voilà un peu ce que je voudrais terminer.
Merci. Merci beaucoup. Now we've got our panels, and I want to say thank you very much. There's a lot of lessons to learn. Lesson around creating trust funds is one thing we have learned. The other one is looking at financing strategic plans at district level, looking at the capacity that is needed to actually develop these costing plans, building some flexibility in our budget cycles so that mid-cycle you can be able to bring on board additional resources that may not have been thought of at the beginning, and also the issue of sustainability. I don't know if Ms. Providence is still there online. She didn't get her statement. Is she still there?
Yes, I'm around.
Yes, so yours is COMESA, which is many countries. So
Yes.
what must we come and learn in the COMESA region?
It's the multi-sectoral and multi-stakeholder approach that we use to address issue of nutrition, and not only looking at one sector like agriculture or health, but also looking at other aspects such as the water, sanitation and hygiene, and social protection program, and also the creating a supportive regulatory environment around the entrepreneurial activity to support the nutrition program. Thank you.
Thank you very much. So please help me to thank our panelists. Thank you very much for the experiences. We'll come and visit Nigeria, Malawi, Ghana, Cote d'Ivoire, and then the COMESA region will have a lot of visitors. Thank you very much.
You too.
Before we call on the next presentation, I would like to ask Dr. Sise to come forward. You have seen the efforts that he presented for Ethiopia, quite extensive efforts being done with managing to get government to spend numbers like 11 million US dollars for nutrition from Treasury. That's a lot. And so a lot of people have been advocating and trying to get those kinds of results come forward. So we just want to recognize some people, and then we will proceed with the program. Over to you, Dr. Sise.
Your Excellency, Ato Dammaka Mokonnin, former Deputy Prime Minister and Minister of Foreign Affairs, Excellency Dr. Leah Taddesa, former Minister of Health, Excellency Dr. Darajje Duguma, State Minister of Health, Dr. Kassata Admasu, the CEO of Big Win Philanthropy, Excellency Elias Magosi, the SADC Secretary Executive Director, Excellency Ms. Afshan Khan, UN Assistant Secretary General and Coordinator for the Sun Movement, Dr. Hamad Nuru, United Nations Representative to AU and ECA, Dr. Ambassador Mohammed Kadah, Assistant Secretary General of COMESA, and Dr. Makuta Lua Blue, the SADC representative and director of the policy planning and resource mobilization. We will start the special session that is organized in this, the Africa Union high-level nutrition side event. As we said earlier, Sakota Declaration is the Government of Ethiopia innovative and bold commitment to end stunting among children under 2 years by the year 2030. When the Sakota Declaration was made back in 2015, there were individuals, sector ministers, and political leaders who championed and played critical role for the signing of the declaration among the federal government and regional governments to prevent over 7.8 million children from stunting. These leaders have influenced the design of the 15 years roadmap, which is divided into innovation, expansion, and scale-up phases, each with 5 years period of time. Sustaining the high-level political and sector leadership commitment, these leaders, along with other leaders who assumed sector leadership role during the course of implementation, contributed for the successful completion of the innovation phase and the launching of and operationalization of the 5 years expansion phase, which started since 2021. We believe they will also sustain their commitment and leadership by providing leadership advice for their successors currently in the government position, and also influence donors until we achieve the Sokoto Declaration ending stunting goal by the year 2030. In this regard, this special session at the Africa Union Commission high-level nutrition side event is organized to recognize few of our Sokoto Declaration heroes among the many, and say them thank you for your sustained commitment and also political leadership and contribution you have made for the Sokoto Declaration to reach to this stage. We still recognize we have more work to do, but their contribution needs to be recognized and acknowledged. The process of recognition will be as follows. First, we will see a short video about the Sokoto Declaration heroes. After the video, we will call them to the stage to receive the award organized by the Ministry of Health. After they receive the award, the awardees will be given few minutes to speak to us, and also the representative from the government sectors, donors, UN, civil society organizations, academia, private sectors, businesses, and also our brothers and sisters from the Africa Union, as well as also Africa Union member states, how we can continue and sustain our commitment to ending stunting in our continent, as well as in Ethiopia. After the closing, the awardees will have also a group photo. Before we go to the videos, I will now call upon Hiwat Darsani, Lead Executive Officer, Nutrition Coordination Office, and also His Excellency Dr. Dareje Duguma, State Minister of Health, to come to the stage to give the awardees the Sokoto Declaration Heroes Award. Can you clap for them to come to the stage?
Freyalem Shababao is an entrepreneur in the education sector with an educational background in business, human and social studies, and development studies. She has worked with women and children for the past nearly 2 decades and is the founder of Bahir Dar Academy and the Ethiopia School Meal Initiative. Freyalem has also served in various government positions, including the State Minister of Peace. When Freyalem was running a private school in Bahir Dar, Ethiopia, a 5-year-old child approached her and asked to be registered at the school despite him not being able to afford it, to the point that he didn't even have a lunchbox. This made her realize how malnutrition affects child development and, in particular, school performance. She explains, "This was the incident that really stopped me and got me thinking about this whole nutrition issue." Right from that moment, she started reading about nutrition in general and began to ask how big this problem is in Ethiopia. How many children are affected by malnutrition? What is nutrition and what is it we need to know about it? This not only made her realize how malnutrition affects school performance, but it also triggered her interest in solving this challenge. It was a turning point for Freyalem, who then started a formal dialogue with cabinet members and state presidents to discuss the issue and do something to change this story. In less than 3 years, to take her part, Freyalem established a school meal initiative in Ethiopia, building on a sustainable community-centered approach with small dairy farms in each school. Moreover, Freyalem advocated the same with high-level government officials and developed a concept note for the government, which enabled the birth of the Sokoto Declaration, a government commitment to end child undernutrition in Ethiopia by 2030. In line with the Sokoto Declaration, she hopes that Ethiopia will no longer have malnourished children in 10 to 15 years, and that Ethiopia can grow to become a country the international community and neighboring countries refer to for successful interventions for ending malnutrition.
Waziri of Realm, you are most welcome to the stage to receive the Sakota Declaration Heroes Award in recognition to your innovative idea in bringing the Sakota Declaration to the political attention to realize the vision of ending stunting in children less than 2 years in Ethiopia by 2030. You are most welcome, Waziri of Realm. Let's give a round of Thank you so much. You have a few minutes to say a few words.
Honorable guests, excellencies, I didn't expect this, so I'm a kind of shocked. Please forgive me if I stumble. I'm honored today to receive this recognition, and also I'm allowed to speak in front of you about the most pressing issue of our time, and an issue that has utmost importance in the building of the future of Ethiopia and our continent, nutrition. In the case of globalization and interconnectedness, government knowledge and commitment on nutrition programs is crucial and more important than ever before, as the world is facing a wide range of problems one way or another in relation to food in general. I would like to take this opportunity to say thank you so much for His Excellency, former Deputy PM Demek Amakonnen, for his unreserved effort to make this happen. Sakota Declaration would not have been in this place unless you had provided a strong leadership and strong commitment on your side, and I thank you, sir. Sakota Declaration can be a very good example for that. It shows the bold commitment made by the Ethiopian government to end malnutrition by the year 2030. This declaration is not just a promise, it is a crucial moment in our history. We used as a turning point to ensure that every child has to end the vicious cycle of poverty, and also a pledge to ensure that every child and every family has access to the nutrition they need to thrive. We believe that it is a battlefield to bring long-lasting and wholesome development in our nation. Sakota Declaration inspired a national and continental movement in scaling up nutrition and food systems. I am very happy to say that food and nutrition is at the center of Ethiopia's development plan. Evidently, the national school feeding program implemented nationally retained students in schools, lowering dropout rates and increasing school performance, also created employment for the thousands of mothers at school premises. Schools are serving as a community transformation center for current students and future students who will join schools in near future. The massive movement to increase household food production initiated by Government of Ethiopia is also a huge move in increasing access to nutritious foods. This shows that the Ethiopian government strongly believes that empowering communities and individuals to make owners of their own nutritional status is vital. Following this national call, there has been many important national tasks undertaken, including agricultural tech innovations, marketplace infrastructures, and revisiting our curriculum in undergraduate and graduate programs in related to food engineering and food systems. More importantly, we are working to make food affordable and available to all. This commitment is not just a dream, it's a roadmap to a better future, but it cannot be achieved by government alone. The scale of the problem will demand coordinated and comprehensive response. That is why we urge all international partners to join this movement. Let's join hands. Let's stand together in solidarity to make Sakota Declaration a reality as a statement to the power of collaboration. I thank you so much.
Thank you so much, Wizara of Realem. We will continue our partnership for the Sakota Declaration. Next, we will see the second video of our Sakota Declaration hero. Next. The video for the second one, please.
Dr. Kaseta Admasu played a leadership role. Dr. Kaseta Admasu played a leadership role in the development of the Sakota Declaration 15-year roadmap. He also played a crucial role in the launch of the Sakota Declaration in July 2015 while serving as the Minister of Health at the time. His influence and contribution to the Sakota Declaration has also continued after he took the role of CEO at Big Win Philanthropy through sustaining Big Win investment in the Sakota Declaration expansion phase. In addition, whenever he makes country visits, the Sakota Declaration is always on his mind. Making sure to reach out to the implementing sector ministries, he influences them to support the declaration, allocate resources, and conduct a site visit to understand the situation on the ground. Dr. Kaseta has taken part of the interministerial learning visit as well as the SD learning journey conducted in Amhara and Tigray regions during the innovation phase. The learning visit to the innovation phase Waredas has been instrumental for the operationalization of costed Waredas based plan and for the federal government to allocate a budget from the Treasury. Dr. Kaseta played a crucial role in mobilizing resources from donors to finance the Sakota Declaration. Through his insightful advice and Big Win Philanthropy's technical and financial support, the innovation phase impact assessment showed an annual stunting reduction for 3 years that was generated with JHU. This was also sustained during the expansion phase. Dr. Kaseta played a pivotal role in ensuring the visibility of the Sakota Declaration experiences on the global stage.
Dr. Kaseta, you are most welcome to the stage to receive the Sakota Declaration Hero Award in recognition to your leadership, commitment to the Sakota Declaration vision of ending stunting in children less than 2 years in Ethiopia by 2030. You have 3 minutes to.
He knows as a former politician, I may not stop when I start talking, so he gave me 3 minutes. Excellencies, all protocols observed. I must thank the organizers for this recognition, for the little role I played in Sakota Declaration. I just want to say how proud I am for what Ethiopia has achieved because of this program. And it is becoming a new blueprint for doing development, not only nutrition, but broader development. What I say, what I mean by that is, imagine all of you working in different departments, coordinating even the various departments within one ministry is a big, big challenge. But to bring together 10 ministries, regional governments, to develop one plan, to have one budget, and to use one tracking system particularly the growth monitoring, as a proxy measure of impact of development efforts at household level requires a strong leadership. And this would not have been possible without the leadership of His Excellency Ato Damaka Makonnen, who has sustained the program. There have been 5 ministers of health, 4 after me, many regional presidents, many ministers. Despite these successive changes in leadership, the program has sustained, and it has not only endured but become very successful as well. So I would really like to thank all of you for making this happen, the program delivery units, the leadership, and then on behalf of the children that have now a better start in life than those that came before them. Thank you very much.
Thank you so much, Dr. Kasata. We will see the next Sakota Declaration Hero video. This is a little bit a surprise because we are also, organizing this event together, but the program delivery unit, the nutrition community, and also, the staff within the nutrition coordination office said that we need also to recognize one additional person as a Sakota Declaration hero. So it's a little bit a surprise, but the video will tell us who the person is. The video will go.
Former Minister of Health Dr. Leah Taddese played a critical role for the Sakota Declaration ever since joining the Ministry of Health as a state minister. During this time, Dr. Leah took part in the Sakota Declaration Innovation Phase High-Level Review and provided a critical role during the Innovation Phase Performance Review among the federal sectors and regional presidents. Dr. Leah, at this capacity, also took part in the interministerial learning journey held in the Sakota Declaration Weredas in Amhara and Tigray regions, where she engaged with families, health workers and frontline workers, and Wereda-level leadership along with other sector ministries and regional government sector bureaus, where it gave her the opportunity to understand the Sakota Declaration multi-sectoral implementation and priority needs. After taking a ministerial role, recognizing the importance of community-led processes and investment needed for high-impact community priorities, Dr. Leah championed and provided leadership guidance across sectors and regions for effective implementation of the Sakota Declaration bottom-up, costed, Weredas-based planning process.
Wereda-based planning tool was implemented in the innovation phase, and it has enabled to have Wereda-level stakeholders to do joint planning, resource mobilization, and effective monitoring of the performance using one plan, one budget, and one monitoring and reporting framework.
Nutrition being at the heart of her agenda, Dr. Leah provided critical leadership for the successful completion of the innovation phase and endorsement of the expansion phase plan to expand the Sakota Declaration Weredas from 40 to 240 Weredas. Dr. Leah also played a critical role for the Sakota Declaration continental and global level events, where she led the N4G side event, shared SD at AUC side event, and moderated the Sakota Declaration high side event at the UNGA. Informed by the impact of the first 2 years of the expansion phase implementation, Dr. Leah has played a critical role in organizing and co-chairing the recently conducted regional and federal government high-level leadership forum, where excellencies from the Sakota Declaration implementing federal sector ministries and the regional presidents jointly endorsed the additional Weredas concept note to expand the Sakota Declaration expansion phase Weredas from 240 to 700 in the coming 3 years.
Come to the state to receive the Sakota Declaration Heroes Award in recognition of your commitment, leadership to the Sakota Declaration vision of ending stunting in children less than 2 years in Ethiopia by the year 2030.
morning, Your Excellencies. My team has cheated me, of course, when we were organizing this recognitions for those who are really from the inception to its phase where it is now. But I'm really truly honored to receive this award in front of all of you, and also really honored to be able to contribute and support the implementation of the Sakota Declaration in the past 5 or so years. As we all know, and as we have been discussing all morning, nutrition, investing in nutrition is truly something that is not only impacting health, but it impacts social, economic development in our human capital development, as well as really help us break this intergenerational cycle of poverty that we are facing across our nations. And the Sakota Declaration is a program that, as a country, we are proud of because it was a commitment that was born out of a passion to bring change, to really address the needs of the children who are facing this malnutrition that can be averted by collective efforts. And this bold commitment and political commitment, I believe, is being manifested in, maybe I can say, primarily 3 ways. Because we are always talking about political commitment, and this declaration is a commitment to end stunting, but how do we translate it into action? I think the first one is what we have been discussing, is for multi-sectoral coordination. It requires commitment to collaborate between sectors. And this should not happen not only at the national level, but also, especially most importantly, at the lowest level, the district level. And that's what we have seen, where the Sakota was bringing more impact. When sectors are working for results together, not just to share the resources and implement, but to make sure the resources go to the most challenged among the sectors. And the second one, I think the political will and commitment is translated by the financial resource allocation that you have seen. That has continuously increased the government allocation, and this has also driven increased resources by donors seeing that commitment. And that has happened again at federal, national level, but also at the sub-national level. And the third one that is that we are recognizing mostly today is the leadership commitment at all levels. And we are fortunate that we had that commitment from the highest level, this being chaired and followed by our Excellency, former Deputy Prime Minister Ato Demmeka, who was there from the inception up to now, leading this program. But also, of course, the leadership at all levels, from the regional president, the ministries, up to the district and lowest level. So I think with a combination of this, we can drive this agenda as a country, but also as a continent, in this especially very challenging time we're having, where nutrition is also being affected by climate change and other challenges as we are seeing. So together, I believe we can do a lot with such commitment. And once again, my sincere thanks. And again, also, thank you to all the leaders here who have really contributed huge, significant role in this Sakota Declaration. Thank you so much.
Thank you so much, Excellency Dr. Leah. We'll see the last, but not the least, video in our Sakota Declaration hero. The video will continue.
Ato Demmeka Mekonnen, former Deputy Prime Minister and Foreign Affairs Minister, played a pivotal role in leading the Sakota Declaration high-level 15-year commitment unveiled in July 2015. The Sakota Declaration is a bold proclamation by the Ethiopian government to end stunting in children under the age of 2 by the year 2030. In pursuit of this ambitious vision, Demmeka Mekonnen led the signing ceremony in the town of Sakota, joined by regional presidents and mayors, solidifying the collective dedication to address this critical social, economic, and developmental issue. Their unified mission is to prevent a total of 7.8 million children from stunting within a 15-year time frame. During the innovation phase implementation, he diligently provided political leadership in overseeing and guiding the efforts of high-level leaders through the Interministerial Steering Committee in alignment with the commitments they have collectively endorsed. In this regard, DEMMECA led high-level forums annually or semi-annually to review the progress and make high-level, course-corrective decisions that accelerate the implementation progress. With his leadership and direction, an interministerial learning journey was conducted in the Sakota Declaration Innovation Phase Waredas of Amhara and Tigray regions. This created an opportunity for SD implementing sectors to observe activities done at the ground level and to understand the daunting challenges of the area. It also created an opportunity for the ministers to hear the voices, challenges, hope, and perception of the communities about the program and their pressing needs. After the visit, the Interministerial Steering Committee decided to allocate a budget for the Sakota Declaration from the Treasury, making it the first government investment fully dedicated to nutrition. DEMMECA is committed to engaging donors and financiers to mobilize resources for the Sakota Declaration Innovation Phase Investment Plan. One great achievement that significantly contributed to the funding gap was the partnership established with Africa Development Bank to work with the banks of the High Fives to improve the quality of life for the people of Africa by reducing the effect of stunting on gray matter infrastructure. This partnership has resulted in a co-financed $48.17 million 5-year multi-sectoral approach for stunting reduction project. Moreover, DEMMECA also took a leading role in the Sakota Declaration to organize a showcase and share its experience with African member states in New York in 2022. During the event, he took a prominent role in spearheading, sharing, and influencing the adoption of the Sakota Declaration experience to other African countries by signing the Presidential Declaration for the Acceleration of Stunting Reduction in Ethiopia. Finally, DEMMECA played a leading role in the food system transformation and establishment of the Food System and Nutrition Interministerial Steering Committee, and has championed for the first 1,000 days actions to curb the impact of stunting on the country's economy, social, and health outcomes.
የአንድ ሺህ ቀን እያንዳንዷን ቀናት ለመጠቀም የሰው ልጅ የተሟላ ስብዕና የተሟላ እውቀትም የመማር አቅም የፈጠራ አቅም ምክንያታዊነትም ከጽንስ ጊዜ ጀምሮ እስከ 2 ዓመት ድረስ ያለው ምን ያህል ወሳኝ እንደሆነ ከዛ በኋላ ብዙ መጠጋገን ይቻላል ግን የሚያመልጡት ነገሮች reversible ናቸው.
Emphasizing that ending stunting is the responsibility of individuals, families, communities, and the nation.
የማይዳሰስ የሚመስል ግን ደግሞ እጅግ በጣም ወሳኝ የሆነ የዜግነት ግዴታ ነው፣ የመንግስት ግዴታ ነው፣ የወላጅ ግዴታ ነው፣ የሁሉም የማህበረሰብ ኃላፊነት።
Your Excellency, Ato Dammeka Mokonnin, you are most welcome to the state to receive the Sakota Declaration Heroes Award in recognition of your leadership and political commitment to the Sakota Declaration vision of ending stunting in children less than 2 years in Ethiopia by the year 2030.
Good afternoon, everyone. Very glad to be here. My honor and privilege to receive this spectacular recognition. Thank you very much. I would like express my profound appreciation to the Ministry of Health, to Dr. Sai, to all different actors from the federal government up to the grassroots levels, the regional, zonal, Warada and Kabale actors, all poverty-oriented sectors who able to contribute and put their legacy to address this critical challenge. To end stunting in children is really one of the top priority to build prosperous society, creative youth community across the globe, especially in Ethiopia. Secretary Declaration, from its inception to now, the progress is very promising and encouraging at the innovation phase. Perhaps it needs further penetration, consolidation, and scaling up activities. The roadmap is clear to scale up this promising project from Sakota Declaration from 40 to 42 waradas to 240 waradas at national level, and then to other countries also. This is very promising roadmap. But the consolidation issue is very critical. Though the progress is very promising there, still serious stunting problem, drought problem, and other interrelated and multifaceted challenges in these pilot areas. The consolidation, the new penetration, and scaling up project is really very critical. So all actors, development actors, the local players, including the private sector, has to march together to change the whole deep-rooted challenges at the grassroots levels. This is time. The practice is already there. The innovation is very promising, but the consolidation and expansion is very pertinent, needs urgency to change the whole history and to overcome these erratic drought problems, climate-induced challenge, and to really build prosperous and productive society. Thank you very much.
While His Excellency is on the stage, I will call upon other awardees to come to the stage to have a group photo. The special session will end here. Now I will call upon Dr. Namukolo to facilitate the next few sessions, and we will close.
Okay, thank you very much. Yes, that was really nice. I think we've learned about finance. There's one more lesson that we have learned, I think, that has not been mentioned, and that's sustaining an effort across different governments, across different ministers. I think that's also a lesson that we can pick up. So I would like to call upon Ms. Kifilwe Mwalusi, who will make a presentation now on specifically guidelines for engaging the private sector for win-win nutrition outcomes. And as she comes up, we've been told nutrition is multi-sectoral, coordination is required, private sector must be part of that coordinated effort. And so this presentation is actually very important to delivering on nutrition. Over to you, Kifilwe.
Thank you so much, Madam Moderator, Your Excellencies, distinguished guests. Thank you so much for standing with us today and for honoring this important high-level SED event. I'll not take much of your time. As you know, we are really behind the time. I'm sure now people need to be food secure, so lunch is waiting. Just to take you through this presentation, I think a lot have been said this morning, and we've seen through these amazing videos of Secota Declaration, ensuring that nutrition is actually a multi-sectoral approach, and they mentioned the value of the school feeding program. And as USAID-NEPAD, we prioritize school feeding program. It's one of our very important flagship programs within the organization. And this has started in 2003 through the comprehensive Africa Agriculture Development Program, which is CADAP. And we're here today to really accelerate nutrition indicators within the CADAP framework. And because, you know, school feeding, home-grown school feeding links the smallholder farmers to the schools, therefore providing a stable market for the smallholder farmers. We know the benefits of school feeding program. As you know, today is the AU Year of Education, so school feeding boosts education outcomes. It requires a multi-sectoral approach for effective implementation. We need all key sectors to play the lead in school feeding program. And also, as USAID-NEPAD, we also advocate for national ownership of the program. We want the government to allocate funding towards home-grown school feeding program is quite important, and to promote local production for local consumption through the schools platform. Our vision there is to have African governments transition into government-funded, and government ensuring that we have the smallholder farmers playing a role and reaching to all the children in public schools. As we call it, universal school feeding program. In other countries, they are implementing universal school feeding program. And we want to see more of the African member states transitioning from the donor-funded programming such as World Food Program to government ownership of the program. Now you heard about the multiple benefits of the home-grown school feeding program. We have seen the videos, they really illustrated the value of school feeding program. We want our children to be to eat healthy meals, as you can see there. The value transfer from our smallholder farmers. The education agenda is also intervened in the school feeding program. We want to see our children being kept in schools to avoid child marriage, for example. Socioeconomic factor also plays a role. Our farmers, they know they have a stable market and there's income at the end of the day. The agricultural sector also benefit from the school feeding program. So now about the guidelines on private sector engagement. It's a win-win outcomes that we're trying to really implement, because all the farmers, all the private sector, they should know that if they invest in nutrition and food security, there is value for investing in such. And USAID-NEPAD and FAO have actually developed the guidelines to really engage more private sector to invest in nutrition. And we're here today to amplify the value of private sector in uplifting nutrition outcomes. So these guidelines actually are there to enable more private sector engagement for better nutrition in sub-Saharan Africa, to mainstream private sector in the CARAP and Post-Malabo implementation process, and of course looking to the value of united food systems approach. The pathways that we have seen from Ethiopia, this is something that we want to really advocate for as AD&NEPAD and help the member states to implement the pathways together with the CARAP. Third point is to motivate private sector to adopt nutrition-sensitive investments as part of the AU strategic frameworks. The fourth point is to strengthen the food and nutrition coalitions. We know I've heard of the School Meals Coalition. That is how we want to ensure that we attract the private sector to engage in the nutrition food security. The last point, as I mentioned, is to attain the win-win outcomes of the private sector engagement for nutrition. Just to show you an example of what we mean when you say win-win solution, as you can see, the smallholder farmer in there, knowing that in return, if he supplies the school children are also having nutritious meal per day. In return, there is dollar sign there, meaning that there's income coming in. As more as we engage the smallholder farmers to supply the schools, we are creating a stable market for them. They will also be motivated to really supply the schools. And this is kind of example that we are trying to advocate for as AD&NEPAD. As we encourage member states to engage smallholder farmers, we know there is return of investment, and therefore the household also, they can have income to also have better nutrition outcomes. Now, what we do with the guidelines on private sectors, that is building on existing strategies that we have. We have developed the school feeding guidelines program as a toolkit to really encourage member states to strengthen the school feeding program through policies as well. If you want to define policies in school feeding, this is what we have developed, and member states are domesticating these guidelines. Just last week, we had a meeting again with of Nigeria government in terms of uplifting or amplifying the school feeding program in Nigeria, and they were using the guidelines to ensure that these guidelines are being implemented in terms of redefining policies on the school feeding program. They have, it's 5 key sectors that are in there to guide the member states. And one of them is including food safety